Bertemu kembali, rangka tindakan ekonomi digital Malaysia My Digital menyebut perkhidmatan penjagaan kesihatan sebagai antara fokus. Ini termasuk meningkatkan penerimagunaan teknologi digital dan juga penggunaan peralatan digital. Ini disasar meningkatkan kecekapan dan produktiviti melalui antaranya penggunaan blockchain untuk menyelaras rekod perubatan. Ini menerusi mempercepatkan penggunaan gudang data kesihatan Malaysia MyHDW dengan memasukkan elemen blockchain. Ini disasar menyumbang kepada 30% peningkatan produktiviti buruh merentas semua sektor. Rangka tindakan ini disasar menjadikan Malaysia sebagai nadi digital untuk Asia Tenggara. Tetapi melangkaui penggunaan gudang data kesihatan Malaysia dengan memasukkan elemen blockchain, apakah lagi suntikan teknologi yang boleh dimasukkan? Ini melihat kepada kepentingan sektor kesihatan di era pandemik dan meningkatkan ataupun peningkatan penyakit yang tidak berjangkit di Malaysia dan juga Asia Tenggara. Menurut Health XL, pasaran digital kesihatan dijangka tumbuh pada kadar terkumpul 34.2% dalam 5 tahun akan datang. McKinsey lapor manfaat ekonomi daripada penambahbaikan kesihatan dijangka menambah $12 trilion kepada KDNK Global pada 2040. Kita ingin bincangkan rangka tindakan ekonomi digital Malaysia My Digital bersama dengan Pengarah Eksekutif dan juga Ketua Pegawai Eksekutif Kumpulan TMC Life Sciences Berhad, Nadiah Wan. Izinkan saya meneruskan dalam bahasa Inggeris. Nadiah, one of the key initiatives is to in My Digital is to accelerate the usage of the Malaysia Health Data Warehouse with the inclusion of blockchain. The aim is for more efficient policy making and leaner operations for healthcare service delivery. Do you think this is sufficient?
Hi, good morning. I think that it's a good start, but definitely what we would like to see in the long term is a comprehensive roadmap that would cover a few important things. I think the key thing here is to build a very strong backbone, and definitely data collection is a very important part of that. The reason why we need that backbone has to be clear as well. And really for health, what we're looking at is better outcomes in terms of safety, better experience for patients in terms of optimization, personalization. And then when it comes to the pandemic, obviously it's very important for us to be able to predict where the issues may arise, so surveillance so that we can plan and mobilize resources. And last but not least is on sustainability, and that means looking at risk profiles, looking at cost estimates, and looking at the general efficiency of the system.
Let's dive deeper. You mentioned roadmap, a bigger, more prominent roadmap. Tell us more about that.
I think that we have had various acts in the past, like for example, the government had a telemedicine act very early on. But I think that the technology and the use in terms of artificial intelligence, blockchain, 5G connectivity, all these new technologies have to be taken into consideration for us to update our strategy and roadmap for the digitization of the healthcare sector. So, for example, I think AI has played a very important part, I think, in terms of predicting. We are dealing a lot with epidemiology models now. In the US and other developed countries, AI is being used to even determine or recommend treatment and procedures for patients. So these are some of the things that I think as the technology very quickly evolves, that we need to think about how we're going to incorporate that into our national plan for healthcare.
And of course, with these technologies, you'll be able to serve your customers, patients better?
Yeah, so definitely one of the key things that we're looking at is on outcome and experience of customers. And to do that, you need to have an integrated backbone. So for us at Thomson Hospital, we are implementing an SAP ISH Med, which is an integrated EMR, ERP, HIS system. And integration, I think, is really important because in healthcare, we have many thousands of medical equipments in just one hospital, hundreds of staff and doctors who are taking down observations, entering data on a daily or hour-by-hour basis, or even continuous monitoring. So it's very important that we have these sources of data integrated into a single source of truth, as it were, so that the right decisions can be made in a timely manner and more cost-effective.
And how do you see the sector, the healthcare sector, becoming a key component of digital economy? What can private healthcare players do to play more or a more important role in the national or My Digital?
I think the key thing is that we are seeing a significant portion of the population, and therefore the data that we collect is very important to input towards the national plan for healthcare to make decisions. So, for example, during the COVID pandemic, it was very important that private healthcare players were able to integrate to the national laboratory reporting system, SIMCA, for vaccination. Now that we need to integrate with the national vaccination database. So there's a lot of data exchange, integration, and without having data from the private sector, I think the quality of policies that are being made probably would not be as good.
Tell us more about this fast expansion of data sharing and the security of data of patients out there. Is there a reason to be worried?
I think governance is definitely very important when it comes to data, because health data is very private. And I think that the government plays a role. Definitely, they have passed the PDPA Act, which applies. And also in healthcare, we have our standards like HIPAA standards that are being used worldwide to ensure that when we integrate, people have same levels of security. But I think that definitely this is going to be a concern to everyone who has access to that data and what would they use that data for.
Would this require the healthcare players to maybe invest a bit more? And do you think the private sector players are in a better position to invest versus the government hospitals?
I think on the contrary, in Malaysia, the public hospitals were actually the first ones to implement electronic medical records. It was Hospital Selayang in the 90s, and the private players actually have been relatively slow compared to the public sector. I think the key thing here is that the investments made for technology are not directly related or seem to be directly related to patient care. And so the justification of the expense to the payers has been quite difficult. Whereas I think for the public sector, because of the scale of the system, they were the first to recognize the benefits. But I think that given the situation now, it's very important that both public and private hospitals have this data backbone that is able to transmit data, whether it's to the MyHDW or other systems like SIMCA, simply because that we need that data in order to plan and mobilize resources more effectively, particularly when we need a whole of government, whole of nation approach in dealing with issues like the pandemic.
So let's look at the My Digital again and discuss the other emerging technologies that you think should also be highlighted. I think you mentioned AI, blockchain to predict future pandemics. But what other emerging technologies should be there to also perhaps provide better care to patients?
I think 5G is going to be very important because of the connectivity and the just sheer amount of data that is being generated on a daily basis within a healthcare system. So this ability to integrate and collect data, to store and to analyze requires actually a lot of high bandwidth. That is very important. Even for one hospital, you have thousands and thousands of equipment, anything from the infusion pumps to the CT, MRI equipment. We need that data so that it's accurately recorded, allocated to each patient, and we're able to do not just individual analysis, but also population level analysis.
I'm going to be a bit of a Jetson here and look at whether this can perhaps provide services to the people in the rural areas, in areas far away from hospitals right now. Can they get pre-diagnosis to their state of health, or how do you see 5G further quantum leaping the services provided to patients?
I think definitely this higher level of connectivity would allow us to extend the services, particularly outside the walls of the hospital. We have started, I think, with teleconsultation, and we see during this pandemic it has been taken up by many people. But with 5G, I think back in 2019, I was actually discussing with colleagues in China and the remote surgery that's being done there using 5G technology. So actually, decentralization of provision of services, not just consultation, but actual procedures could possibly be in the future as well. Continuous monitoring devices that perhaps people in the interior who are facing chronic diseases like heart problems, diabetes, they could just wear fitness monitors and be monitored from a distance. All of these are actually becoming possible now. It's not just a pipe dream, but has been demonstrated, particularly in other countries like the US and China.
Tell us more about this increase, the 30% increase in labour productivity, the aim set in My Digital. Do you think the aim should be higher as opposed to just 30% labour productivity increase?
Well, as you know, like Malaysia has always been facing this issue with productivity. So I actually think if we can achieve 30%, that would be good. And the main thing is because I think in healthcare, it's still predominantly a very people-centric business. But there is a very extreme shortage of trained resources in healthcare. So any productivity increase that we have, I think would have multiple impact on the outcome, and particularly on the sustainability of the care that we want to deliver in terms of cost, whether we even have the resources to provide that care.
And lastly, Nadiah, I know we've discussed this so many times, and Thomson Hospital has also adopted the usage of social media to communicate between doctors and staff. Tell us more about simple innovations like that for small players and how it could help possibly with their productivity, with making better decisions at the end of the day for the patients itself.
I think simple technology, for example, one of the things that is overlooked is actually queue management. And we realize that actually now with technology, you know, everybody or almost everybody has a smartphone, and you can manage the queue remotely using the mobile phone and integrate that into your system. And the whole point about the queue is about maximizing the flow of people through your facilities. It's not just about calling people one by one. And if you can optimize this queue, you actually improve the patient experience tremendously, because most of the time what people complain about is waiting time. So these are some of the small things that we're doing, just looking at smart queue systems, so that you're allocated to the first available slot, so that we can send you an SMS to tell you that you have 2 people ahead of you, so please come back to the clinic because your turn is up. We can give you an update that your next station that you need to go to after seeing the doctor is the lab, and put you waiting in the queue. So these are things that actually improve patient experience, that are not requiring huge systems like SAP, but can make a real difference to the day-to-day lives of patients as well as our employees.
On that note, thank you very much Pengarah Eksekutif dan Ketua Pegawai Eksekutif Kumpulan TMC Life Sciences, Nadiah Wan, membincangkan berkenaan dengan My Digital serta teknologi yang boleh membantu sektor kesihatan awam dan juga swasta di luar sana. Teruskan bersama kami, kita akan berhenti berehat seketika, kembali selepas ini.